Dr. Vicki Peterson here. A reader writes in asking whether gluten sensitivity can be cured. He said that his nutritionist had mentioned to him that after a period of time he felt that he could get healthier and be cured of gluten sensitivity and not have to worry about consuming gluten anymore. So I definitely wanted to address that because this does come up as a question frequently. We kind of live in a time where maybe you know people who don't do well with dairy products, but they say in moderation they can do it, or they don't do well with eggs, but if they consume something with an egg in it, they don't seem to notice it. So this kind of thought process does make sense. However, when it comes to celiac disease and gluten sensitivity, for what we know right now, I'm not trying to be a pessimist, but for what we know right now, would not be recommended to begin consuming gluten again. The problem is this: we have there is a genetic issue, it seems, with gluten sensitivity as well as celiac disease. There's different research showing. We know celiac definitively has certain genes associated with it. Newer research is also looking at certain genes that are more associated with gluten sensitivity. That work is still being done. But we do know this, that gluten can be very overt in how it gives you symptoms, and by the same token it can be very covert, meaning that if someone eats something with gluten and gets bloating and gas and diarrhea and these overt kind of gastrointestinal symptoms, or even a migraine. I have a patient who within several hours of eating gluten, if she stumbles into it, gets a migraine. These are dramatic, these are fairly immediate responses within several hours. Very easy to figure out, this is not working for me. But what about the patient who eats gluten and several days later feels tired, or several days later has joint pain or irritability, anxiety, symptoms like that? Do they always know that's associated with gluten? One of the biggest things we see in our patients is that they do get healthier, they feel so much better, and they start to cheat just a little bit. And when they first start cheating, they're waiting for that big kind of explosion to happen, something dramatic, and when it doesn't, it kind of lures them into this false sense of security that maybe it's not so bad, maybe I can have a little bit. And often it's many months, sometimes up to a year later, where they come back into the clinic saying, I don't really know what's wrong, my health is not where it was when I last saw you. As a matter of fact, I almost feel like I'm starting all over again. And it's interesting how they've forgotten that they've reintroduced gluten into their system. Even if it's sporadically, it's back in there. So I personally am doing some research and looking into whether if we can truly get the small intestine intact and truly optimally healthy, if a body might be able to sustain occasional gluten, very small amounts. That's just something I'm looking into from a clinical science research perspective. But for what we know right now, do not go there, don't cheat. It's so worth your health, and oh my goodness, there's so many gluten-free products out there. Just go out, enjoy. Plus there's so many naturally gluten-free foods. All of our fruits and our vegetables and nuts and seeds and the whole grains that are not wheat, rye, barley, or the contaminated version of oats. There's so much out there to eat and enjoy and not worry about it creating ill health. So I hope this helps, and until next time, to your very good health.